In today's health alert, West Nile virus showing up much earlier than usual this year, according to the CDC. Experts worry this could indicate an active and severe mosquito season ahead. Dr. Nandi joining us live to explain why this may be a tough year for West Nile virus. Doc?
Yes, I mean, it's the earliest start to the season in more than 20 years. That's right, 2 decades. As of June 30th, the CDC has reported 48 human cases. Now, that may not sound like a lot for many people, but back in 2004, the season also started this early and ended with more than 2,500 cases and 100 deaths. Now, what's really concerning, Simon, this year is the severity of the cases we're seeing. Nearly 80% of the cases have involved the most serious form of West Nile disease, and that's when the virus affects the brain or nervous system, leading to brain inflammation or something called meningitis. This can become life-threatening and require immediate medical care. Now, here in Michigan, we've had 1 human case of West Nile so far reported in Detroit. I expect we'll see more as the season continues because Michigan has seen an increase in cases over the last several years. We had 26 cases in 2023, 34 in 24, 61 in 25. Macomb, Oakland, and Wayne counties, along with Kent County, have typically seen the most West Nile virus activity. And while serious illness, right, Simon, can occur at any age, adults over 60, along with people who have weakened immune systems, we talk about this all the time, or people with chronic medical conditions face the greatest risk of severe illness.
Yeah, very serious concerns. What symptoms should people watch out for, and how can people protect themselves?
And here's the thing, Simon, most people who become infected, about 80%, don't have any symptoms at all. And so about 1 in 5 develop a fever, headache, body aches, or a rash, and usually recover. Although fatigue can also, last and linger. In more severe cases, infection can spread to the brain or nervous system, and that causes neck stiffness, disorientation, tremors, seizures, paralysis, even coma. Unfortunately, there are no approved specific treatments or vaccines for people. Recovery can take weeks or even months. And that's why the prevention part is important. Preventing mosquito bites is so important. We talked about this before, but use an EPA-registered insect repellent, especially around dawn or dusk when mosquitoes are most active. Wear long sleeve and pants if you're outdoors, and remove standing water from items like buckets, flower pots, and bird baths where mosquitoes breed. I tell my boys this all the time. A few simple steps, I believe, can go a long way toward preventing mosquito bites and West Nile virus throughout the rest of the summer. You don't have to worry about and not enjoy it. Just follow the precautions.
Yeah, very important guidance. Thank you, Dr. Nandi. And if you have a question for the doctor, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook.